Hello, my name is Dipesh Raghwani and I'm Clinical Lead for Greater Manchester LPC. The aim of this video is to support you to deliver a really successful flu service this year and actually to make sure that you're flu ready. The important thing for this year is to make sure that all your resources are ready, so your SOPs are written, printed, signed by your team, your DOC is done and completed and in your file, and also that you've completed the NHS BSA declaration online to make sure that they're aware that you're delivering the service and to make sure that you can claim for the service that you're delivering as well. The LPC has produced a list of the eligible groups and it's on our website. You need to print that off and keep it with your check-in bench, but also near your PC where you're dispensing or your main dispensing computers. We also recommend that you nominate a flu champion. The aim of the flu champion is to support you to deliver a really successful campaign this year, but also to nurture the service and to take some of the pressure off in terms of cascading training to your team. It's important that your team are aware of which groups are eligible, which medicines are eligible, so if they have a prescription or if they're looking at the clinical record or the PMR, that they can identify those patients for you as well. They're really there also to support and take some of the workload off in terms of signing the patients up, and if you train them well, they can actually take a huge amount of workload off you. The other thing you need to be aware of is to have a good system for flagging patients. Patients who come in with walk-ins or who are collecting and they're going to be on the shelf, you need to know that these patients are eligible at the point of handout. A really good system. Some pharmacies use dots, some pharmacies will have a stamp, but however you do it, you need to make sure that your team and everyone who's working is aware of that system and how they can initiate that conversation with patients. The LPC has produced some really good resources and they'll be delivered to pharmacies who express an interest in the next couple of weeks. There's going to be balloons, some A5 flyers, some window stickers, some bag stickers. If you think these will be of use to you, we may have a few packs spare. Let us know and we can get those sent out to you as well. Also, it's really important that when they come in for the flu jab, and if you do deliver that, you actually make every contact count. And they may be eligible for other services. For example, they may be due an MUR, they may be eligible for an inhaler technique assessment. While they're there, make sure you do that as well, actually, to maximise the time that you have and to make that contact count. If you have any questions, do contact us on the inquiries at gmlpc.org.uk email address, or do contact us by phone for further information. We really wish you a best successful flu campaign this year and hope that you'll have a really successful one.